Hi, everyone. Welcome to the All Things Amyloid podcast, where we feature patients, caregivers, and clinicians who discuss amyloidosis, a rare and incurable disease. Amyloidosis occurs when the body builds up abnormal amounts of misfolded amyloid protein, which can lead to serious and life threatening outcomes. I'm your host, Mackenzie, an amyloidosis patient and founder of Mackenzie's Mission. Our goal for this podcast is to raise awareness and share firsthand what it's like to live with this disease, to care for those affected by it, and to treat it. We hope this leads to earlier diagnosis and start of treatment, which will improve patient lives. It's key for frontline healthcare providers to know about amyloidosis and the most common symptoms. They can play a valuable role in suspicion, leading to early diagnosis, resulting in life changing benefits for patients. Today, our guest is Dr. Jenelle Murphy, who has a doctorate in physical therapy, and she's here to talk about how physical therapists can help identify signs and symptoms of amyloidosis. Early diagnosis in this rare disease is extraordinarily important, especially since there are multiple FDA-approved treatments that can help prevent amyloid buildup throughout the body. If physical therapists are more aware of these signs and symptoms, they can refer the patient out to appropriate physicians and get a full workup and possibly save a life. Thank you, Janelle, for joining me today. It's wonderful to have you on the podcast.
Hi, Mackenzie. Yeah, thanks for having me. I really appreciate this opportunity today.
Yeah, of course. So, can you start by telling us why you think it's important to educate physical therapists on this rare disease?
Yes, of course. So, there are actually several reasons why I think it's important to educate physical therapists. So, as you mentioned, I'm a physical therapist myself, and I graduated PT school about 8 years ago. And I honestly barely remember having one PowerPoint slide on amyloidosis, if even.
Sounds about right.
Yeah, when my dad got diagnosed, I was like, I don't even remember really learning about this. So, there are just so many diseases and diagnoses, signs and symptoms that we all have to learn about in PT school. And there's just so many different rare diseases that we really don't have time to cover all of them. So, I think it's important for PTs to have that continuing education and always just keep learning about additional things that we weren't able to in PT school. So, the second reason is because as physical therapists, we do spend a lot of time with our patients. We do take a very thorough medical history. We usually see our patients for an hour at a time, 2 to 3 times a week. And really, no other healthcare professional spends this much time with their patients outside of being in a hospital. And so I really think there's a lot of opportunity to really dig into their signs and symptoms. And, as physical therapists, it's really important to note when things are outside our scope of practice for the best interest of our patients and when to refer out to another healthcare professional. And then I would say the third reason is that we all know that rare diseases are most likely more prevalent than they really are because of being underdiagnosed and misdiagnosed. And, unfortunately, many physicians, including orthopedists and cardiologists, are still really not familiar with amyloidosis. And so, in addition, a lot of these physicians unfortunately mistake it for general heart failure. And if the PT profession can help identify these individuals that may have been misdiagnosed or not diagnosed yet, we can really make a change in these people's lives, which we will, go into further detail later in this episode.
Yeah, I think that's such an important point. There really is kind of tremendous opportunity to identify these patients maybe earlier than they would have otherwise been identified as having amyloidosis. So, really getting everyone involved and being on the lookout for amyloid is important. And you
Yes.
mentioned you didn't get much training on amyloidosis in PT school. So share with us kind of when you first became aware of it.
Yeah, so I unfortunately did have a personal experience with it. In March of 2021, my father was diagnosed with wild type amyloidosis. And so that's really when I started researching it more and becoming more familiar with the disease.
Mhm.
And so throughout his life, he was really diagnosed with everything under the sun. And he had around a total of around 23 surgeries, which is just mind boggling to me.
Yeah.
So, some of those misdiagnoses that I can think of off the top of my head throughout the years, he was diagnosed with rheumatoid arthritis, which obviously it wasn't that. He was diagnosed with complex regional pain syndrome, which was formerly known as RSD. And he had all sorts of orthopedic diagnoses, traditional heart failure, and honestly, the list goes on. And, unfortunately, it wasn't until he was 65 that he received the proper diagnosis of amyloidosis. And I always like sharing this story because it gives me goosebumps every time I share it. So, his cardiologist that he was going to in Arizona had been treating him for idiopathic heart failure
Mhm.
and, didn't really mention anything else. And so this particular cardiologist had gone to a continuing education course at Mayo Clinic about amyloidosis. And so during the next appointment, his cardiologist, really started asking him all these like specific orthopedic questions. And my dad's like, what's going on here? And that's kind of what started everything. So the cardiologist referred my dad to Mayo Clinic to look more into his symptoms. And, to this day, I believe that if that physician did not go to that CEU course, we wouldn't have had as much time with my dad as we did after his proper diagnosis.
Yeah, I think that's a wonderful story and really just highlights the importance of educating the medical community and making people aware of this disease because,
Mhm.
clearly it looks like a lot of other diseases, but when you're treating someone, say, for idiopathic heart failure and idiopathic heart failure treatments aren't working, it's time to start looking somewhere else. And
Right.
so having these education opportunities for healthcare providers is so important. But aside from that, I want to thank you for sharing your connection to amyloidosis, and I'm so terribly sorry to hear about your father.
Thank you.
And it's just unimaginable challenges that come along with going through something like that and misdiagnosis after misdiagnosis. But for those physical therapists who may be listening and may not have a lot of experience with this disease, I'd love if you could just give us a high level kind of overview summary of what amyloidosis is.
Yeah, absolutely. So, as physical therapists, hopefully we all know that we have amyloid proteins in our bodies that are biodegradable. And so, amyloidosis is when these proteins become abnormal and they misfold and they almost kind of become like sticky, right? And they are resistant to being broken down. And so, these amyloid protein deposits actually accumulate in the body's tissues and organs, which cause abnormal functioning. And so, physicians have identified more than 35 proteins to contribute to amyloidosis when misfolded. But for today's sake, we are going to focus on the two major types today. So, the first one I'll kind of give a high level overview on is the primary type, which is AL amyloidosis. So this amyloid comes from plasma cells in the bone marrow, and this type of amyloidosis is actually very similar to multiple myeloma, and it typically affects the kidneys, heart, liver, GI tract, and nerves. And then the second type is ATTR, and this can be either hereditary, so it could be passed down through your family, or it could be the wild type, which they really don't know what the cause of the wild type is yet. So with ATTR, the protein is coming from the liver, and this type usually causes cardiac disease in the elderly and can be accompanied by other issues such as neuropathy, GI tract issues, and musculoskeletal problems.
So, would a physical therapist actually be able to make the diagnosis of amyloidosis?
No. So, as physical therapists, we would not be able to make a true diagnosis. For a diagnosis, there needs to be a tissue biopsy. sent to a pathologist to identify whether there are amyloid deposits present, and then also to identify what type of amyloid deposits there might be. However, this whole episode is about how PTs can help identify the disease earlier, by learning the signs and symptoms. And so, if we're able to identify these and refer our patients out accordingly, it can actually lead to an earlier biopsy and diagnosis. And so, this acceleration to then start treatment is the real life saving impact that PTs can have for their patients, which is just amazing.
Yeah, I couldn't agree more. I think it's a great point that you make. In the amyloidosis world, we hear over and over again that kind of the earlier diagnosis you can get, the better the outcome. It's just shocking the fact that just catching this disease years earlier, like you said, has life saving, life altering impacts because now, we have so many drugs out there that are available for both of those kind of two most common types of amyloidosis. And so there's all the more reason than ever to be getting kind of all eyes on the lookout for amyloidosis.
Yeah, absolutely.
So before we go into the details of some of the signs and the symptoms, is there a certain age range that you might recommend that physical therapists kind of be on the lookout for?
Yeah, so this is a really great question. Thanks for asking that. So typically, amyloidosis is diagnosed later in life, but it can also occur in younger adults. So I think the more educated we get about the signs and symptoms and the benefits of diagnosing amyloidosis early, we'll be able to recognize the disease sooner in individuals. So for an example, my dad wasn't diagnosed until he was 65. And that was because the amyloid got so bad that it started affecting his heart and he was having cardiac symptoms. However, when he was younger, probably like in his early 40s, he did have bilateral carpal tunnel surgery and revisions on both of them. So I feel like with the knowledge the medical field has today, they probably would have likely sent his carpal tunnel tissue into pathology to look for the amyloidosis, um, which, back then, unfortunately, there weren't medications out yet, which we'll talk
Yeah.
about in a little bit. But, I still think it could have made a different impact on his life. So, as we are going through these signs and symptoms, keep in mind that amyloidosis can really affect anyone at any age.
Yeah, absolutely. So now that you've given us kind of a high overview of what amyloidosis is and what ages we should be looking out for, what are some of those signs and symptoms that you believe physical therapists should really be on the lookout for?
Yeah, so as you guys can probably tell by now, amyloidosis is one of those tricky diseases because it can affect almost any organ in the body, and it really depends on the individual on where the amyloid congregates. And in addition, it depends on what type of amyloidosis somebody has. So I'll kind of go over the ATTR type first. And so they say that three red flags are actually orthopedic related.
Mm.
So these three things include a history of bilateral carpal tunnel syndrome, most likely with that revision surgery that we had talked about, spinal stenosis, and biceps tendon rupture. And so, going back to my dad's case, he did have a history of all three of these diagnoses. And unfortunately, a lot of individuals don't get diagnosed until the amyloid starts building up in their heart and someone starts having heart failure signs. And, as physical therapists, if we can help identify people that have this history and refer them to the appropriate healthcare provider. Now that we have medication, we can actually help save somebody's life. So, kind of touching on medications a little bit, up until 2019, there really weren't any medications for amyloidosis. But since then, the FDA has approved several medications. And what some of these medications do is they help prevent the protein from unfolding and building up in the organs. So if somebody, you know, is identified of having amyloidosis, in their 30s, 40s from a carpal tunnel surgery, and they start taking this medication early, it can actually help prevent those cardiac issues from forming in the future. So, again, super important.
Absolutely.
Um, and so I do want to go back to the bilateral carpal tunnel syndrome for a minute. So I do know that there have been several studies published about the correlation between carpal tunnel and amyloidosis. And what it basically says is it shows a higher percentage of positive diagnosis with those individuals with bilateral carpal tunnel. So, with this information, I do know that amyloidosis specialists are trying to educate, orthopedic surgeons on taking biopsies during carpal tunnel surgery in hopes of, that earlier diagnosis. And again, as PTs, we can definitely be a part of identifying some of these patients more at risk.
Yeah, absolutely. And I'm really glad you mentioned those studies. I remember one of them was at the Cleveland Clinic. And I'm not exactly sure what year it was, but it was a large study a number of years ago. And they found that for people undergoing carpal tunnel release surgery bilaterally, that 10 to 15% of those patients actually had biopsy proven amyloid. And, furthermore, to stress the importance of identifying it early, they've also found that bilateral carpal tunnel syndrome can often be one of the earliest indicators of amyloidosis, often, 5 to 10 years before patients have critical organ involvement. So for say that heart failure. So to be able to identify, a relatively common condition and have PTs be able to hone in on that and almost do a little risk assessment in terms of, okay, this person might be a person who could be at risk for amyloidosis, and that's something that we should keep in the back of our mind. But I
Right.
also want to touch on, I appreciated you mentioning those three orthopedic related red flags, right? The bilateral carpal tunnel, the spinal stenosis, and the biceps tendon rupture. And I just wanted to add in a little point that patients don't necessarily have to have all three, like your dad did.
Right.
Even
Hmm.
just one of those can certainly indicate amyloidosis. So, um, looking at those even individually, if your patient has just one of those, it's important to still think amyloidosis. And if they have all three, I mean, you really need to be thinking about amyloidosis and be suspicious of it. So,
Yeah.
I'm so glad you added those points for us.
Yeah, and thank you for adding the point of, even if they only have one of those symptoms, to still have amyloidosis on your mind.
Yeah, yeah, certainly, and it's a huge opportunity that I think physical therapists have, and particularly with orthopedic manifestations, and knowing that those are often early indicators that there's just tremendous value to be on the lookout, and it really can change lives by just being aware of amyloidosis. Say a physical therapist identifies a patient that has maybe some of these specific symptoms, how would you recommend, or what kind of physician would you recommend that they maybe refer their patient to do some further investigating?
Yeah, so that is a great question as well because, even though we have this global diagnosis of amyloidosis, each type is treated very, very differently, right? So, um, as a physical therapist in the clinic, we might notice some of these symptoms, but we might not know exactly, if it's ATTR amyloidosis, if it's AL amyloidosis.
Sure.
And so the best thing to do from the beginning is, probably refer them to their primary doctor, and really just explain to the primary doctor that, explain the disease to them, what their concerns are as a physical therapist. And so their primary physician can then refer out as well. However, I would say if, as a PT, you really, really notice those cardiac symptoms as well as those additional things we just talked about, I would even consider referring them straight to, an amyloid cardiologist or amyloid specialist if their insurance allows. And, thankfully, there is a growing list of such experts across the country. And so, when I go over the signs and symptoms of the AL type next, we'll kind of talk about what physician kind of oversees that care.
Absolutely. So let's get into it. What would be some of the signs and symptoms that may suggest that they have the AL type?
Yeah, so again, AL amyloidosis, just as a brief review, is the type that the plasma cells in the bone marrow produce an abnormal antibody protein, which again misfolds and are deposited into organs around the body. So the signs and symptoms really can look different.
Mhm.
In each individual. So just to list some of the common, more common signs and symptoms would be extreme fatigue, shortness of breath, frothy urine, blood pressure changes, dizziness, unexplained weight loss, diarrhea or constipation, tingling in fingers and toes, and kidney issues. And I do feel like even though a lot of these necessarily aren't things PTs directly treat. They're things that we still should be asking during our, evaluation of, medical history and the history of present illness. So I do feel like with the amount of time physical therapists spend in an evaluation, they would be able to kind of pick some of these things out. And so, like I mentioned earlier, because this disease is so complicated, there usually are several different types of physicians that are involved in an individual's care. However, the care is usually led by a hematologist with expertise in amyloidosis for the AL type. So, like I said earlier, you're not necessarily going to know what type somebody has in the clinic. So, it's best to refer to their primary physician first, and then just kind of go from there.
Yeah, thank you for going into detail about some of those signs and symptoms to be aware of. And I do know physical therapists work in lots of different settings. And so, would you recommend that all physical therapists be on the lookout or in certain medical settings for these sorts of signs and symptoms?
Yeah, so that is a great point to bring up because, as a PT, I've worked in probably 10 different settings already. So, in terms of settings that are appropriate to be on the lookout, would include anybody that's working with the older adult population for sure,
Mhm.
especially looking out for those cardiac symptoms. But honestly, any other setting, such as traditional outpatient clinics, acute care in the hospital, short-term, long-term rehab, or home health, really should be on the lookout for this. So, I mean, really, the only PTs that shouldn't really have to worry about this diagnosis are pediatric PTs.
Yeah, I appreciate that. I think that's some great advice and really just showing that amyloidosis is kind of everywhere. So it's
Mhm.
important that, everyone's kind of tuned into some of the things that patients might present with. But as a physical therapist, just out of curiosity, have you ever treated or anyone with amyloidosis?
Well, not to my knowledge. I have treated a lot of patients, so I would assume somebody out of that bunch probably had it, but wasn't diagnosed at the time. But of course, I did have experience with my dad, and because of this, I did refer one of my patients to a cardiologist because she did have all the signs and symptoms, and she actually did end up testing positive for
Wow.
amyloidosis. And so this was probably like 3 years ago, maybe. Probably 2 years ago. And so she was started on the medication, and she was just so thankful that I referred her. And it just felt so good that I was able to, really change the trajectory of her life.
Yeah, of course. That's an amazing story, and I think it's I'm sure you did change the trajectory of her life. I mean, had you not known about amyloidosis, had you not been suspicious of it based on her symptoms, who
Mhm.
knows how long she would have gone about her life before. she was actually given a formal diagnosis. So I think that's a wonderful story. So thank you for sharing that.
Yeah, of course. And I actually do want to add that when I called the cardiologist's office, I did have to explain what amyloidosis was. They said that they they've heard of it, but they weren't, experts in it.
Mhm.
So I did, say I had a personal experience with my dad. Like, this is pretty much the same presentation my dad had. And so they actually referred her to like a amyloidosis cardiologist after
Yeah,
that.
that's a great story. I appreciate you sharing that with us.
Of course.
And so, even though you haven't necessarily formally treated a patient with amyloidosis, what would your advice be to a physical therapy that comes across this diagnosis in the chart?
I would say don't get overwhelmed. As physical therapists, we aren't necessarily treating the amyloidosis. We're helping to treat the symptoms caused by the amyloidosis. So, a few examples would be if somebody does have spinal stenosis or carpal tunnel, we're really treating the patient as we normally would with those diagnoses, just kind of knowing that they do have amyloidosis as well. And then, a couple other things we might be treating or helping our patients with are is managing their heart failure. So again, it's all the normal stuff, making sure that they they are educated about the weight gain, the sodium restrictions, the liquid restrictions, and really just helping them manage the symptoms of being short of breath and teaching them how to deep breathe and things like that. And then also blood pressure management. So, again, we would treat an individual the same as we would whether they had amyloidosis or not with the blood pressure management. So, again, it does sound like a scary diagnosis, but we're not treating the amyloidosis, we are treating the symptoms.
Well, Janelle, thank you so much for taking the time to help us increase awareness and educate physical therapists on really the tremendous opportunity and the role that they are able to play in help getting an earlier diagnosis. And I would just love for you to share maybe a couple of takeaways from this episode for our audience.
Yeah, no problem at all. So, now that we do have that medication to help slow down or prevent the amyloid deposits, as we keep saying, it's just so important to identify ways in which we can diagnose earlier. And so, three takeaways that I think are very important here are: listen to your patients, right? They know their bodies best. And, I just want to mention that as medical providers, we tend to have 2 to 3 diagnoses in our head within the first 5 minutes of taking a history. And I'm going to tell you, I'm guilty of that, right? Like, I think every healthcare provider is. And
Absolutely.
yeah, sometimes this helps, or sometimes this, prevents us from thinking outside of the box. So I just want to encourage all of you physical therapists that are listening to keep an open mind when you are taking that history and even for follow-up visits, really listen to your patients and what they're saying. The second takeaway is I would say if you have any suspicion of this disease, it's best to refer out because obviously treating amyloidosis is not within our scope of practice. And it really is better to be safe than sorry. So if you have any suspicion of this disease, refer out. And then the third point I would say is always keep learning. So, as I told you my dad's story earlier on how he got diagnosed, I really do feel like if my dad's cardiologist did not attend that CEU at Mayo Clinic about amyloidosis, my dad wouldn't have been here for as long as he was. So, never stop learning and be sure to practice at the top of our license. So yeah, I just really want to thank you again, Mackenzie, for having me today to help raise awareness of amyloidosis and how physical therapists can help with that early diagnosis.
Yeah, absolutely. It was an absolute pleasure to have you with us, and really highlighted a real significant opportunity that exists out there to make a significant difference in patients' lives and their quality of life going forward. And just simply having a suspicious and thinking about amyloidosis is enough. That's really all you've got to do. And
Right.
so I appreciate you kind of letting us into the world of physical therapists and the role that they play within our healthcare team. And, for our audience, if you are a physical therapist or really any type of frontline healthcare professional, you can make a difference. You can be on the lookout for amyloidosis and no doubt that will save patients' lives. Thank you for listening to the All Things Amyloid podcast. If you find our podcast informative, please follow and share it with others. If you want to learn more about the work we're doing at Mackenzie's Mission, please visit mm713.org. We'd also like to thank AstraZeneca Pharmaceuticals, Alexion Pharmaceuticals, Alnylam Pharmaceuticals, and Bridge Biopharma for their sponsorship to help raise awareness about amyloidosis. We hope you stay tuned for future episode drops. Thanks for listening.